Hello everyone and welcome to this audio podcast. Today looking at an important overview of a chemokine receptor CXCR3. Um, this audio podcast is as part of the conglomerate. This audio podcast is part of a Lobostics Storm. This audio podcast is part of a Storm and Battle and Chronicle. And this audio podcast is part of the Ztormish edition or series. And this audio podcast is part of a Storm Lobostics production. Excuse me. In as part of looking at the chemokine receptor CXCR3, a bit of intro. So CXCR3 is primarily an interferon inducible chemokine receptor expressed in various cell types, but preferentially monocytes, Th1 type T cells, CD8 type T cells, and NK or natural killer type T cells, and dendritic cells, and some cancer cells. Homeostatic proliferation of T cells in immune depleted individuals can also lead to enrichment of CXCR3 positive T cells. The CXCR3 receptor reacts with three interferon inducible chemokines, CXCR9, CXCR9 being chemotactic for MIG or MIG, CXCR10 being chemotactic for IP10, and CXCL11 being chemotactic for ITAC, and in addition to CXCL4. The main chemokine ligands of CXCR3, so for example CXCR9, CXCL10, and CXCR11 have limited expression under homeostatic conditions, but are rarely upregulated by cytokine stimulation. In around sort of the chemokine superfamily in and through sort of a clinical or medical text, chemokines play pivotal roles in physiological processes of immune cell maturation and trafficking. Chemokines also regulate inflammatory processes inducing and maintain and amplifying inflammatory immune reactions. Two classes of chemokines: the inflammatory inducible chemokines and the homeostatic or constitutive chemokines form the two classes of chemokines. Inflammatory chemokines direct the recruitment of effector leukocytes at sites of inflammation during infection, in tissue injury and tumors. The homeostatic chemokines control lymphocytes and dendritic cell trafficking and immune surveillance. Dual function chemokines participate in immune defense functions and target non-effector leukocytes. And as part of the immune sort of a general immune response, the general immune response in as part of and through a basis of CXCR3, the inflammatory processes during solid organ transplantation and rejection are complex and constitute a sort of multifaceted network among organ and resident cells, infiltrating cells, cytokines, and molecular mediators contributing to injury to allograft. The injury to allograft is mainly due to the graft infiltrating T cells that produce a response which directly or indirectly affects recipient graft function, allograft function. Macrophages and neutrophils are induced to produce toxic molecular mediators. The expression of immune-induced chemokines CXCL10 and 9 and 11, CXCL9 and CXCL11, and corresponding receptors, including CXCR3, is or are broadly upregulated. Solid organ transplantation it sort of induces a vigorous anti-donor T cell response, which is initiated by migration of T cells from the donor organ to recipient spleen. In the spleen, anti-allograft T cells migrate to the allograft, where they get activated to express effector functions such as, for example, cytolytic activities and cytokine production. Now looking at a little bit in around CXCL10 ligand. The CXCL10 is a dual function CXC chemokine. CXCR10 has the base of being induced by interferon gamma with CXCL9 and CXCL11. CXCL10 is a potent chemoattractant for various immune cells, such as activated T helper type 1 cells, natural killer cells, dendritic cells, and macrophages. It is secreted by immune cells such as leukocytes, neutrophils, eosinophils, and monocytes, and non-immune cells, including epithelial, endothelial, keratinocytes, and stromal cells. Enhanced CXCL10 production in allografts or in circulating blood of solid organ transplanted recipients is associated with its increased concentration in specimens. So, for example, in serum and in plasma. CXCL10 was one of the first initial ligands detected sort of post in laboratory investigations investigations around solid organ transplantation and in allografted recipients. There have been observed an association between CXCL10 expression and the acute rejection of solid organ transplants, or renal or solid organ transplants. Higher expression of CXCL10 might predict allograft loss at 1 year post-transplantation, post-solid organ transplantation, confirming the fact that higher intrarenal chemokine expression is a risk for premature graft or allograft loss. Looking at allograft rejection. So, despite the significant advances in immunosuppression or IST, acute rejection remains a crucial barrier or hindrance to long-term prognoses. Acute rejection of a solid organ transplant or allograft is suggested is sort of a clinical feature, such as where clinical features are aligned to fever and oliguria and additional pathophysiological symptomologies. Ischemia and reperfusion injury after solid organ transplantation is marked by the accumulation of neutrophils and monocytes. Acute rejection is characterized by recruitment of T cells and natural killer cells and macrophages, followed by tissue injury. Chemokines affect all phases of injury by regulating leukocyte recruitment and inflammatory responses. Chemokines have been identified and established through histological findings and through renal biopsy investigations. A number of chemokines and receptors as corresponding receptors in human renal solid organ transplantation have demonstrated an increased expression in acute allograft rejection. heightened expression of various immune cell components in peripheral blood leukocytes correlate with acute allograft rejection. A quick look at biomarkers. So biomarkers, peripheral biomarkers are currently investigated have been investigated and documented, wherein investigations have looked to determine both the pre and post solid organ transplant immune status or status of and around the immune status in recipients in order to predict or detect even acute or chronic allograft rejection. Evidence has shown that there is an association between the levels of interferon gamma inducible interferon gamma inducible protein CXCL10 and the inflammatory immune process occurring during allograft solid organ transplantation or allograft transplantation. Excuse me. And then finally, biomarkers for assessing recipients' pre-transplantation immune status may be helpful to tailor IST to monitor the balance between rejection risk and pharmacotherapeutics in order to minimize side effects. As part of now looking at sort of specific laboratory sort of assay, although the particular laboratory assay is not so novel or new now, but it has been an important laboratory assay in and through where immunobiological or immunology investigations for where solid organ transplantation is concerned. So now looking at sort of a Luminex assay. So determining MIG or CXCL, MIG IP10 and ITAC levels using Luminex assays may offer and sort of have in some ways have offered non-invasive means to diagnose T-cell mediated acute allograft rejection in renal recipients, and it is a high throughput assay which detects numerous chemokines and cytokines in a small amount of serum. The joint detection of MIG, IP10 and ITAC in the serum using Luminex analysis can constitute a non-invasive and efficient modality for early prediction of T-cell mediated acute rejection following solid organ transplantation. CXCR3 and its ligands may be reliable biomarkers for T-cell mediated acute rejection. The detection of MIG, IP10 and ITAC in the serum is easier and more efficient compared with the determination of CXCR3 on cell surface. Now looking at some quick outline on CXCR3 antagonists. So laboratory mice investigations lacking CXCR3 have shown to tolerate mismatch cardiac allografts for extended durations. positive effects of small molecule CXCR3 blockade on allograft's prognosis was investigated in a variety of laboratory transplant investigations. Blockade of CXCR3 by the compound MRL957 results in a moderate increase in allograft prognoses. Administration of CXCR3 antagonists to allograft recipients have prolonged allograft survival prognoses with short-term, low-dose co-stimulatory blockade. The small molecule antagonist TAX779 is described as a CCR5 CXCR3 antagonist and has demonstrated efficacy in several in vivo investigations. Data from retrospective investigations have highlighted promising CXCR3 antagonists which are well tolerated and achieve sufficient levels of blockade. The complex pharmacology of CXCR3 may provide opportunities for an unbiased approach to antagonists with the potential for greater efficacy and selectivity. And as part of the summary then, CXCR3 chemokines are strongly associated with T helper type 1 cell trafficking during immune response in allograft rejection. The detection and quantification of CXCR10 in fluids may be helpful for monitoring the inflammatory status of organ transplanted recipients and to determine positive outcomes. CXCR10 CXCR3 interactions appear to play an important basis in the pathogenesis of allograft rejection in multi-organ specialties and laboratory investigations. The detection of CXCR3 ligands in serum using Luminex assay or analysis may be a non-invasive and efficient method for the early stage prediction of T-cell mediated acute rejection. The detection of MIG and IP10 and ITAC in serum of recipients may constitute a method for diagnosing acute rejection episodes post-transplantation. And despite CXCR3 antagonists to date failure in clinical trials, and to date there have been failure in sort of clinical in amongst different clinical trials, and CXCR3 antagonists have shown efficacy. However, in animal investigations of the disease. That draws this audio podcast to a close. This audio podcast is part of the conglomerate. This audio podcast is part of a lobostic shystorm. This audio podcast as part of a Storm and Battle and Chronicle. This audio podcast is part of the Ztormish additional series, and this audio podcast is part of a Storm Lobostics production.